Okay, ji, so I was talking about the coronary ligament. Ji. I told you before the coronary ligament that is going to extend from the posterior edge of the liver to the diaphragm. So it is going to, it's a peritoneal reflection. You can define it as this peritoneal reflection that holds the liver to the inferior surface of the diaphragm. You can see over here. It has got the two layers, बच्चे. ठीक है ना? एक तो मैंने आपको दिया ना anterior or the superior, that is basically coming from the, this falciform ligament which is running over the right over here. ठीक है? And the other one is the inferior layer. I just show you on the posterior inferior surface. The one is here that is coming down over here, along the superior margin. That is called as the anterior or the superior layer of the coronary ligament. And other one here, you can see this one on the posterior aspect, posterior inferior surface. This is the inferior layer. And you see this anterior and the inferior layers, they are going to join each other and form the right triangular ligament. So the anterior or the superior layer or the inferior, the posterior layer, these are going to join with each other at the right edge of the liver, and they are going to form the right triangular ligament. Okay? And from this right triangular ligament, you can see these two layers, they are going to diverge from each other, right? And they are going to hold this triangular area, roughly triangular area, right? And this area is called the bare area of the liver. And this area of the liver is called bare because this area of the liver, it is divided the peritoneum. अब देखिए ना, ये जो show कर रही हैं, this inferior layer or the right, and this the superior layer or anterior or posterior, these two layers, these are, showing the attachment of the peritoneum. These parts are peritoneum attached, right? So this is this area which is present between the superior and inferior layer, which is extending from, you see this right triangular ligament. So it's this triangular area that is enclosed by these two attachments of the peritoneum over here. This area, this is the area which is marked as the bare area. Bare area means that it is divided of the peritoneum, and here this is in a part of the liver which lies in direct contact with the diaphragm. ठीक है? और इस bare area में this region, right, this semilunar shaped impression, it is the area of the right suprarenal gland. So here you can see that this attachment to the coronary ligament, ये दोनों layers जो आ रही हैं, इसकी superior layer आ रही है और ये इसकी inferior layer आ रही है जो कि इस area का bound कर रही है. So it is representing that this bare area of the liver, it is related to the diaphragm. ठीक है? Then the suprarenal gland and the inferior vena cava. If you just remove the inferior vena cava from here, this depressed area, right? So this whole area of the bare area, which is divided with the peritoneum, it includes the attached contact with the diaphragm, right suprarenal gland, and the inferior vena cava. So this whole area, this reflection of the peritoneum is representing this area. This is called as a bare area. Is it clear, Ji? कोई problem तो नहीं है. Okay, now anterior layer over here, you can see that it is going to be continuous. Yeah, it is the anterior layer जो falciform ligaments are. So it's going to continue on the left side over here, right? ठीक है? With the left layer of the falciform, the left layer is going to continue with the left layer of the falciform ligament. मैंने आपको बताया था ना कि right और left में divide हो जाती है. So it's going to divide to the left layer of the falciform ligament. And the posterior layer, if you trace the posterior layer or the inferior layer, this one. So if you trace it posteriorly, then it is, if you follow it, then it is, follow the pattern like this, follow the, inferior vena cava region and then chordate lobe. So it is just going to attach along, it's going to be continuous with the right layer of the lesser omentum. मैंने आपको बताया था ना कि ये ligamentum venosum, the fissure for the ligamentum venosum, there is attachment of the lesser omentum. So this inferior layer, posterior layer, it is going to be continuous with the right layer of the lesser omentum in this region. ठीक है ना? So you can see this inferior surface, this posterior layer, it's going to be continuous along with the margin of the bare area, and then ultimately it is going to join the to the right layer of the lesser omentum. ठीक है जी? Is it clear?
Yes, sir.
And if you trace it more posteriorly, then this posterior layer here and the anterior layer from the upper side, they are going to join each other at the left edge of the liver, lobe of the liver, and it is going to form another ligament that is called as the left triangular ligament. ठीक है ना, जैसे यहाँ पे देखें ना कि ये anterior layer and the posterior layer, they will join each other on the right margin of the the right lobe, and they are going to form the right triangular ligament. Similarly, here if you trace the attachment of the posterior layer and then the anterior layer, which is going to be continuous here with the left layer of the falciform ligament, ये देखिए यहाँ से ये आ रही है, ठीक है, इसके साथ आ रही है, and then they are going to meet each other at the edge of the left lobe of the liver, and they are going to form another ligament that is called as the left triangle. Is it clear, Ji? So as far as the peritoneal attachments are concerned, we have talked about the falciform ligament, then the coronary ligament. Now we'll talk about the right triangular ligament over here. This one. The right triangular ligament, it is just some type of peritoneal suspensory ligament of the liver. Okay, it is formed by the the superior and the inferior reflections of the right coronary ligament. Okay, and this ligament is longer than the left side ligament is shorter and it is longer than the short ligament. Right? And this is situated where it is situated at the right extremity of the bear area. ठीक है ना, ये देखें ना, मैं बताया था ना कि बेयर एरिया की राइट एक्सट्रीमिटी जहाँ पे आपकी ये superior and the inferior reflection of the right coronary ligament will meet each other, right? And they are going to form this right triangular ligament. So here it is present over the extremity, right extremity of the bear area, and from here it is going to be attached with the undersurface of the diaphragm. So it is going to as a suspensory ligament, going to suspend, hold the or suspend the liver with the inferior surface of the diaphragm. ठीक है जी, कोई प्रॉब्लम तो नहीं है? Have a look at this left triangular ligament. So this is also the fold of the peritoneal that connects the posterior part of the left lobe of the liver. ठीक है जी, posterior part of the posterior left lobe of the liver to diaphragm, and anterior layer. I told you before that this anterior layer जिसकी आ रही है, it's going to be continuous with that of the left layer of the falciform ligament. देखिए falciform में आपके यहाँ से right पर turn कर रहा था, तो इस anterior layer it is going to be continuous with the left layer of the falciform ligament. इसके अलावा और पेरिटोनियल अटैचमेंट है जी लीवर के ऊपर? falciform ligament हमने पढ़ लिया. We have talked about this coronary ligament, we talked about the right triangular ligament, left triangular ligament. इसके अलावा भी कोई अटैचमेंट है पेरिटोनियम की जी? सुफियान, you were telling me कि जी सर मैं पढ़ रहा हूँ, लेसर मेंटम की अटैचमेंट नहीं पढ़ी थी बच्चे? Told you before the lesser mentum, it is going to be attached where? It's going to be attached in, it's got this L-shaped, attachment, vertical into the fissure for the ligamentum mechanism, and horizontal part is going to be attached with the margins of the porta hepatis, right? And inferior it is attached where? Inferior कहाँ पे attached होगा जी? Lesser mentum. Superior the liver पे हो गया ना? तो inferiorly, what is this?
Lesser curvature of the stomach.
Lesser curvature of the stomach, right? So this is the peritoneal attachment of the liver. Okay. Now we'll talk about the blood supply of the liver. The blood supply of the liver, it is of course been done by the hepatic artery over here, the common hepatic artery. You can see this one, and it is a branch of the celiac trunk. Okay. The liver is receiving its blood supply from the common hepatic artery, which is the branch of the celiac trunk. Okay, and when it will it will run downwards and to the right, and then it will reach just at the upper border of the first part of the it turns upward in the किसमें ये run करेगा जी? In the free margin of the lesser mentum, ठीक है ना, which is going to form the anterior wall of the epiplaque foramina. याद है किसी को? The three structures running in the free margin of the lesser mentum, right, forming the anterior wall of the epiplaque foramina. On the right side hepatic artery, sorry, left side is the hepatic artery, right side is bile duct, and posterior to these two structures, third one, the portal vein lying in it, right? So it is going to then run over here, and then it will reach in the area of the porta hepatis, and the porta hepatis is going to divide into the right and the left hepatic arteries, which are going to their respective lobes. ठीक है जी? कि प्रॉब्लम तो नहीं है बच्चे? वेनस ड्रेनेज में
नो सर।
ओके जी। अच्छा, वेन्स वेनस ब्लड कहाँ से आएगा जी इसमें? वेन कौन सी एंटर हो रही है जिसमें?
द पोर्टल वेन।
तो बेटा ये तो पोर्टल वेन एंटर हो रही है, पोर्टल वेन तो बाहर आना चाहिए, वेन तो बाहर आती है ना लिवर में से। व्हाई इज गेटिंग इनसाइड?
हेपेटिक वेन।
हेपेटिक वेन।
हेपेटिक वेन कहाँ पे नजर आ रही है आपको? कहाँ पे होती है हेपेटिक वेन? वेल द पोर्टल
सर
वेन
पोस्टीरियरली थी, पोस्टीरियरली थी।
posteriorly होती है. Very good. So portal vein, basically I told you that it's the vein which is carrying the blood which is rich in the nutrients and the absorbed material, right? And that blood will enter into the liver, of course, for the absorption and for the process. So portal vein, which is going to be formed by the splenic vein and the spermatogenetic vein going to form the portal vein, right? And this portal vein will run upwards and to the right. Okay, ji? Just behind the first neck of the pancreas, and then the first part of the duodenum, and then it will be running behind the right artery, behind the bile duct and the hepatic artery, posterior to that one, in the right free margin of the lesser mentum, and then it will reach into the porta hepatis over here. And when it will reach the porta hepatis, it's going to divide into the right and the left terminal branches. ठीक है जी? Is it clear? Okay. As far as the hepatic veins are concerned, which are responsible for carrying of the deoxygenated blood from the liver to the systemic circulation, and that is basically done by the hepatic veins. Here you can see we have got three hepatic veins, and these hepatic veins are the right, middle, and the left hepatic veins. ठीक है जी? Right, middle, and the left hepatic veins, and these hepatic veins, these are going to leave the liver from its posterior surface. ठीक है? These hepatic veins, they have to do nothing with the porta hepatis. ठीक है? They are going to leave the liver from its posterior surface, and directly they are going to open into the inferior vena cava. ठीक है? So you see, we used to say this thing that liver is held in its position by the attachments of certain ligaments, right? So we have a falciform ligament has abdominal wall से कर रहा है, right? Then the coronary ligament है, then right and left जो हैं ligaments, these are responsible to hold the liver in its position, hanging down from the inferior surface of the diaphragm. ऐसे ही है ना जी? But you see that another important factor by which the liver is held in its place is due to the presence of these veins also. Okay? So these three veins, they are not only responsible for collecting the blood from the liver, from all the parts of the liver, deoxygenated blood, and deliver it to the inferior vena cava, but it is also responsible for anchoring the liver in its position and hold it tight with this attachment to the inferior vena cava. ठीक है? ये inferior vena cava में enter हो रही है ना, तो ये it is just like an anchor which is just going to hold the liver also in its place. So another important factor which is responsible for suspending the liver in its position in its place, that is by these hepatic veins also. Remember this one. ठीक है जी? कोई प्रॉब्लम तो नहीं है बच्चे? अच्छा. No. As far as the blood supply of the liver is concerned, I told you that the blood is being carried into the liver. It's carried into the liver by the two sources. कौन-कौन से two sources हैं जी? Hepatic artery and the portal vein. And you see, the 20% of the blood supply to the liver is carried out by the hepatic artery, and 80% is carried out by the portal vein. ठीक है बेटा? So 100% में से 20% जो blood supply है liver की, it is carried out by the hepatic artery, and 80% of the blood which is going to enter into the liver, that is coming from the portal vein. ठीक है? And hepatic artery, it is going to carry what? It is going to carry the oxygenated blood, where the portal vein is going to carry the blood rich in the products of digestion, right, which are absorbed from the gastrointestinal tract. ऐसे ही जी? When these two vessels, they are going to enter into the liver, they are going to divide on right and the left branches, right? And in the liver, they are going to divide into segmental branches. देखिए, अब ये right lobe में आई है, right hepatic artery and right branch of the portal vein है ना, so they are going to divide into segment. मैं आपको बताया था ना कि every lobe is going to divide into the 4 segments. Right lobe की भी 4 segments हैं और लेफ्ट लोब की भी 4 सेगमेंट्स, राइट. सो दीज आर गोइंग टू डिवाइड इनटू दी सेगमेंटल वेसल्स, ठीक है. दीज सेगमेंटल वेसल्स फर्दर डिवाइड इनटू दी लोब्यूलर, ठीक है जी. वो डिफरेंट लोब्यूल्स में डिवाइड हो जाएंगी. There is called as the interlobular vessels, right? And then the further, ramification of these, lobular vessels, they are going to open into the areas. These are called as the hepatic sinusoids. Or the hepatic sinusoids are the places, ठीक है. The hepatic sinusoids, you can see कि यहाँ पे ये vessels आ रही हैं, the interlobular vessels, and they are just going to open into this space, these spaces, sinusoids. These sinusoids, these are basically the low pressure vascular channels, basically, right? That receive the blood from the, जहाँ पे आपकी hepatic artery and the portal vein, दोनों का blood यहाँ पे आके mix हो जाता है जी, ठीक है. उन channels के दोनों साइड के पर hepatic cells पड़े होते हैं. ये जो आपका है ना sinusoid, इनके दोनों साइड्स पे hepatic cells पड़े होते हैं. And from here the products, these are absorbed and taken up by the hepatocytes. I just show you somewhere else. Okay, here you can see this one. ठीक है बच्चे. तो you see ये आपकी hepatic artery is coming over here, and then this portal vein, the both blood, they are going towards, you see in these channels, these are called the sinusoids, ठीक है. These are what, these are the low pressure vascular channels जहाँ पे आपका hepatic blood and the जो आपका ये जो है portal vein का जो blood है, they are going to mix in this region, ठीक है, in channels में. you see in both sides of these channels we have got these hepatocytes, ठीक है. So the products which are being absorbed by the the oxygen from the artery and the products of the digestion which are absorbed from the GIT and taken up by the portal vein. So these are taken up by the hepatocytes through these channels, ठीक है जी. इन sinusoids में आने के बाद जो आपके जो ये hepatocytes you can see these are the hepatocytes, ठीक है. And this space between the sinusoid and the hepatocyte, this space, this is called the space of Dissy, ये याद रखिए, ठीक है जी. और ये these are the sinusoids जिसमें से आपका जो ब्लड जो है दोनों आपके मिक्स होते हैं और यहाँ से न्यूट्रिएंट्स एंड ऑक्सीजन इज बेसिकली बीइंग कैरिड taken up by the hepatocytes. Is it clear जी? कंसेप्ट डेवलप हो गया आपको कि साइनोसाइड्स कैसे फंक्शन करते हैं, ठीक है. और इसकी जो फर्दर रेमिफिकेशन ऑफ द आर्टरी एंड द वेन एंड लीड टू द फॉर्मेशन ऑफ द low pressure vascular channels. These are called as the sinusoids. Is it clear बच्चे? No, we talk about a bit about
सर
the
ये रिपीट कर दो प्लीज.
क्या.
सर ये साइनोसाइड्स का जो आपने बताया
But I
स्पेस ऑफ
told you these sinusoids, these are the low pressure venous channels, ठीक है. ये ऐसे channels हैं, you can see that these are terminal portions जहाँ पे आपका जो hepatic artery और portal vein की जो terminal lower branches हैं, they are going to enter into a space, ठीक है. वो स्पेस है जहाँ पे दोनों ब्लड आपस में आके मिक्स हो जाते हैं. और स्पेस के दोनों तरफ भी है गॉड द हेपेटोसाइट्स. यू सी दिस स्पेस, दिस इज ल्यूमन ऑफ द साइनोसाइट्स. और इसके दोनों साइड पे आपको ये क्या नजर आ रहे हैं, हेपेटोसाइट्स नजर आ रहे हैं. और दीज आर द यू सी दीज आर द प्रोजेक्शंस, राइट, फ्रॉम द हेपेटोसाइट्स ओवर हियर, ठीक है जी, राइट. और द स्पेस, ये साइनोसाइड्स और सेल्स के दरमियान में देयर इज अ स्पेस, and this space is called as the space of Dissy, right? So this is a space where the exchange of the nutrients and oxygen takes place between the sinusoidal blood and the hepatocytes. Is it clear?
यस सर.
Okay. Now we'll talk about the hepatic venous system. वो भी आप देख लीजिए. No, these are the areas of these are sinusoids, ठीक है जी. These are the areas of sinusoids. ये ठीक है, ये sinusoid है जहाँ पे, और इन्हीं साइनोसाइड्स में ये सी यहाँ पे आपके इंटरलबुलर वेन्स ओपन होती है, ठीक है ना. साइनोसाइड्स में जहाँ पे दोनों ब्लड वेसल दोनों आके ड्रेनिंग देयर ब्लड, तो जब वो तमाम उसमें से ऑक्सीजन एंड न्यूट्रिएंट्स आर टेकन अप बाय द हेपेटिक सेल्स, देन दैट ब्लड that will travel into through these sinusoids into these interlobular veins, ठीक है जी. These interlobular veins, they are going to open into the central veins. ठीक है जी, ये central vein है. और central vein में आने के बाद these central veins they are going to open into these sublobular veins, and these sublobular veins unite to form the hepatic vein. ठीक है, is it clear जी? So the venous drainage में hepatic sinusoids, इसका track क्या है जी? Hepatosinusoids. Hepatic sinusoids से जो blood is going to drain into the interlobular veins, and from the interlobular veins it's going towards the central vein. And central veins they are going to open into the sublobular veins, and sublobular veins they are going to form the hepatic veins. And hepatic veins, I told you, these are 3 number. This the right, middle, and the left. And these hepatic veins they are going to open directly into the inferior vena cava. Is it clear? But a problem to need. Now we'll talk about the lymphatic drainage. So lymphatic drainage में बच्चे, I have just told you before, okay, the lymphatic drainage is of course towards the hepatic nodes which are present in the porta hepatis, right? Now most of the lymph, in the liver, actually the lymph from the liver is carried by the 2 types of the lymphatics, the superficial lymphatics and the deep lymphatics. ठीक है बटे, जो superficial lymphatics हैं, these are collecting the lymph from the fibrous capsule, or rather you can say the outer aspect of the liver, right? And that's outer capsule of the liver, that is also called the Glissen's capsule. ठीक है, तो वहां से जो आपका lymph is going to travel through the to the hepatic lymph nodes. Just looking for that. Sorry, I don't have the pic right now, I think. Well, so the hepatic lymph nodes, they are located here in the porta hepatis, right? And the deep lymphatics, they are also going to, which are collecting the lymph from the deeper part of the liver. And you see the most of the lymph that is basically produced in the deeper parts in the, I told you, the pericidal space of the disc. Even a space of disc. So most of the lymph from the deeper aspect that is basically, formed in these spaces of disc. So यहाँ से जो lymph will travel through the lymphatic channels, and they are going to drain into the hepatic lymph nodes. But remember one thing, that the liver is going to produce the larger amount of the lymph. Okay, larger amount of the lymph from the body, that is going to contribute about 1/3 of the lymph of the body. 1/3 to 1/2 of the body lymph का करता है liver, contribute करता है. ठीक है जी. And I told you before, the lymphatic vessels from the liver, they are going to open into the hepatic nodes, which are located in the porta hepatis, and of course porta hepatis say the hepatic nodes say the lymph will travel towards the celiac group of the lymph nodes. Hepatic artery कहाँ से आ रही है, उसकी origin क्या है, celiac artery, right? So it is going towards the celiac group of the lymph nodes. And the lymph vessel from the posterior surface here, posterior surface का जो lymph vessel, right, they passes through the diaphragm to the posterior mediastinal of the lymph nodes. ठीक है? So the posterior part का जो area, that is that is the bare area, specifically this area, this one, right? This area, the lymph from this area, bare area, that is going to the posterior mediastinal lymph nodes. ठीक है बच्चे? But as far as the nerve supply is concerned, तो nerve supply क्या होगी जी? कौन बताएगा जी? पढ़ चुके हैं nerve supply, काफी डिटेल से पढ़ चुके हैं. जी
सर, hepatic plexus.
हेपेटिक प्लेक्सिस, चलें. हेपेटिक प्लेक्सिस का कहाँ से आएगा जी? जो हेपेटिक आर्टरी के साथ रन कर रहा है, राइट? इट्स एन ऑफशूट ऑफ द ठीक है, हेपेटिक प्लेक्सिस. तो ये कहाँ से आएगा? It is coming from the celiac, because I told you before, बच्चे, if you know the arterial trunk, arterial tree का आपको पता ना कि hepatic artery कहाँ से आ रही है, वो is coming from the celiac artery. तो celiac artery के गिर जो plexus बना था, that is the celiac plexus. It's also called a solar plexus, right? It's a sun shape, ठीक है ना? एक sun की तरह इसमें से rays निकल रही है, like it's called a solar plexus. And this celiac plexus, it is going to be formed. It is receiving its sympathetic nerve supply from the, हाँ जी कौन कहेगा? Its sympathetic nerve supply is coming from the greater splanchnic nerve, right? और उसकी जो parasympathetic है, these are coming from the anterior vagal trunk. I told you before, na, the anterior vagal trunk, it is going to give the large hepatic branch, which will pass directly to the liver through this plexus. right? So the sympathetic part of the hepatic plexus that is contributed by the greater and the lesser splanchnic nerves, whereas the parasympathetic part, it is going to be contributed by the anterior vagal trunk, which gives the large hepatic branch. ठीक है जी, हम पढ़ चुके हैं इसके बारे में, यहाँ तक बात करिए, कोई प्रॉब्लम तो नहीं है बच्चे? ओके ओके जी, now I'll talk about the subhepatic space जी, ठीक है जी? subhepatic space क्या होती है? Subhepatic space, but it's, as you know, there's a portion of the supracolic compartment of the peritoneal cavity, ठीक है? That lies immediately below the liver, ठीक है? ये liver और उसके बाकी structures में, this is part of the peritoneal cavity, greater, you know, sac, ठीक है? Greater sac of part which lies between the, you know, these structures, which is present on the posterior inferior surface and the liver, right? So it is lying below the liver, that is called the subhepatic surface, right? So the portion of the supracolic compartment of the peritoneal cavity immediately below the liver, it is called as the subhepatic space, right? Now this subhepatic space, इसकी जो posterior superior extension है, right? This one, ठीक है? This posterior superior extension, that is, you know, just lying between the right kidney and the right suprarenal gland and the posterior surface of the liver, right? This extension of the subhepatic space, that is called as the Morrison's pouch or the hepatorenal recess. ठीक है? Its name is representing hepatorenal, between the right kidney and the liver. I told you before, the right kidney is going to make an impression on the posterior inferior surface of the liver, right? So this space of the, you know, extension of the greater sac of the peritoneal cavity, right here in this region, this posterior superior extension, this is called as a Morrison's pouch. ठीक है? और जो Morrison's pouch जो है, it is basically bounded anteriorly. You can see यहाँ से liver को reflect किया हुआ है, so the anterior is bounded by the liver and the gallbladder, ठीक है? और posteriorly you can see the right kidney के ऊपर the right suprarenal gland is over there, ठीक है? यहाँ पे आपको hepatic collary inflection नजर आ रहा है. Then we have got this second part of the duodenum, ठीक है? So and उसके अंदर the head of the pancreas. So these structures, these are going to form the posterior boundary of this Morrison's pouch, ठीक है जी? And superiorly क्या होगा जी इस जगह पे? Renal impression पे superior, there is attachment of the peritoneum. क्या कौन सी attachment थी जी? किसी को याद है?
Coronary ligament.
Yes, inferior layer of the coronary ligament. Here you can see this. ये देखिए ना, ये किस चीज का impression है? ये renal impression है ना किडनी का. ये colic flexure, right? ये duodenum है, right? So superiorly, this is bounded by the attachment of this ligament, right? The inferior layer of the coronary ligament, right? And inferiorly, this pouch, it is going to be continuous with the, you see, general peritoneal cavity है ना, ये सारी general peritoneal cavity, ठीक है जी? So and laterally, यहाँ पे laterally क्या चीज होगी जी? एक और जगह से देखो, ये देखिए, this is a pouch, this is a Morrison's pouch area. ये देखिए, anteriorly liver reflect किया हुआ, posteriorly आपको kidney नजर आ रही है, right? Second part of duodenum, suprarenal glands के बीच है, और यहाँ पे भी एक और hepatic flexure, right? ठीक है? Superiorly bounded by the inferior layer of the, you know, coronary ligament, or inferiorly it is the general peritoneal cavity. इसके साथ communicate कर रही है, right? और left side पे you can see this one. ये क्या है जी? Mental bursa, ठीक है? Lesser sac है left side पे. और right side पे there is a attachment of the diaphragm. So this pouch, Morrison's pouch, ठीक है? It is going to communicate here through this, you know, lesser sac. ये lesser sac के साथ यहाँ पे communicate कर रही है, ठीक है? ठीक है? Behind this, you know, lesser omentum, it is going to communicate with the lesser sac, ठीक है ना? और anteriorly, superior, it is going to communicate with the, अभी हमने पढ़ा था, in the most upper part between the, you know, here, liver and the diaphragm. This is what? This is the anterior right subphrenic recess, ठीक है? So superior, it is going to communicate with this right superior, you know, right saphenous recess, and on the right side is going to communicate through this, bursa, this, lesser momentum or the epiploic foramen to the lesser side. ठीक है बच्चे? So इसकी इंपॉर्टेंस क्या है जी? Whenever there is an infection, peritonitis होता है ना बेटे, so the fluid, when we are just going to, peritonitis में क्या करते हैं? We are just going to open the, tummy, and we are just going to wash it with the normal saline dirt सा होता है कि इसमें जितना भी infected में कोई pus है, कोई infected material है, then we have to just, flush it off. ठीक है? So when we are going to do this procedure, so we must be very careful to get all the fluid out of that pouches also. ठीक है? इसको अच्छे तरीके से wash करते हैं areas को, so that एक इन्फेक्टेड जो फ्लूइड का जो है ना थोड़ी सी even a smaller amount of the infected material should not be present in these spaces. So when we are just going to form the we called it as a peritoneal lavage, right? So when we are going to perform the peritoneal lavage, so we have to remove all the infected fluid which is present in the gravity dependent areas. लेकिन अब यहाँ से fluid अंदर चला जाएगा तो वो gravity dependent lesser sac में चला जाएगा ना, mental bursa में चला जाएगा. So we have to wash those areas. ठीक है? These recesses very careful so that के infective material को हम properly wash out करते हैं. ठीक है? तो peritoneal lavage को properly कर दीजिए. ठीक है बच्चे? Everything is clear?
Yes, sir.
Now we'll go for the segments of the lobes of the liver. ठीक है जी? We'll talk about it in detail now. Okay, बच्चे. To divide the liver into the functional right and left lobes and different segments, we got in the middle on the posterior surface one that is called the main portal fissure. ठीक है? एक मेरे पास main portal fissure, right? The main portal fissure, it is going to divide the liver into the right and the left halves. ठीक है जी? And here you can see this one, the main portal fissure, right? Which is going to divide the liver into the functional right and the left halves. ठीक है? On the diaphragmatic surface, right? The diaphragmatic surface, it is marked by an imaginary line that is called as a cantilli line. ठीक है? Just show you. Okay. So on the diaphragmatic surface, we draw an imaginary line, right? That is called the cantilli line, right? And this line passes. कहाँ से pass करेगी जी? जहाँ से we have got the notch for the gallbladder anteriorly, and posteriorly we have got the notch of the inferior vena cava here. ठीक है? So on the diaphragmatic surface, we have got the imaginary line which is called as the cantilli line, beta, and that cantilli line, it is marked by the notches for the gallbladder and the inferior vena cava. ठीक है? And on the visceral surface, this main portal fissure, it is marked by the presence of this right sagittal fissure. ठीक है जी? So जो main portal fissure है, basically it lies at the level of the right sagittal fissure. ये बात तो clear होगी जी आपको? ठीक है? तो right sagittal fissure में जहाँ पे I told you that anteriorly bounded by the gallbladder and posteriorly by the inferior vena cava, right? So it is going to mark the presence of the main portal fissure, जो कि liver को functionally right और left half में divide कर. ठीक है? और अगर हम इसको diaphragmatic surface में mark करेंगे तो we'll make an imaginary line on the diaphragmatic surface that is called as the cantilli line. ठीक है? Sometimes you ask the question, okay, what is the cantilli line? So it is an imaginary line which is going to divide the liver on the diaphragmatic surface into the functional right and the left halves. Is it clear जी? कोई problem तो नहीं बचे?
No.
Okay. So here you can see this is the right liver. ठीक है, this is right lobe. So this one is what? This one is the left lobe. ठीक है. So left lobe. अच्छा. Over here you can see this one. Now the left lobe. So left lobe में बच्चे you can see this is another fissure. This is called as the umbilical fissure. ठीक है जी. Left sagittal fissure or the umbilical fissure, and it is going to divide this left lobe into the left medial and left lateral lobes. ठीक है जी, कोई प्रॉब्लम तो नहीं है. This fissure, अब हमारे पास दो लीवर हो गए ना जी, एक राइट साइड पे हो गया, एक लेफ्ट हो गया. Now we'll talk about the left lobe. The left lobe, it is again divided into the two divisions, two parts. The one is the medial, left medial part, and the left lateral part. ठीक है जी. Left medial part and left lateral part is basically contributed by the presence of this one. This is a, which is a left umbilical fissure, the left sagittal fissure. यहाँ तक बात क्लियर है. Okay, better remember one thing, that the main portal fissure जो है, वहाँ पे आपकी middle hepatic vein run करती है जी. You can see this one. ये आपका मेन पोर्टल फिशर जो कि राइट एंड लेफ्ट हाफ में डिवाइड कर रहा है, राइट. और इसमें आप कौन सी वेन रन कर रही है? द मिडल हेपेटिक वेन. सो द मिडल हेपेटिक वेन, इट इज गोइंग टू मार्क द प्रेजेंस ऑफ द मेन पोर्टल फिशर व्हिच इज गोइंग टू डिवाइड द लिवर इनटू द राइट एंड द लेफ्ट हाफ. यहां तक बात क्लियर है? नाउ द राइट पोर्टल फिशर में हियर द राइट हाफ, अब राइट सॉरी लेफ्ट में मैंने आपको बता दिया जी कि लेफ्ट पार्ट को कौन चीज क्या चीज डिवाइड करेगी जी? लेफ्ट लोब को द अम्बिलिकल फिशर और द लेफ्ट सैजिटल फिशर गोइंग टू डिवाइड इनटू द लेफ्ट मीडियल एंड द लेफ्ट लेटरल कंपार्टमेंट्स. ठीक है, क्वेश्चंस में करते हैं. सिमिलरली ऑन द राइट साइड पे भी बच्चे देयर इज एन डिवीजन, राइट, एंड दैट इज कॉल्ड द राइट पोर्टल फिशर. ठीक है, इन दिस राइट पोर्टल फिशर it is going to divide the right lobe into the right medial and the right lateral, or the right anterior or the right posterior divisions. ठीक है जी, प्रॉब्लम तो नहीं यहां तक बचे. पहले बेटे मेन पोर्टल फिशर ने लिवर को राइट और लेफ्ट हाफ में डिवाइड किया. ठीक है, फिर जो लेफ्ट लोब है इसको आपके लेफ्ट सैजिटल फिशर ने लेफ्ट मीडियल और लेफ्ट लेटरल में डिवाइड कर दिया. सिमिलरली ऑन द राइट साइड there is another fissure that is called as the right portal fissure. तो बेटे ये जो right portal fissure है इसकी कोई external boundary, external demarcation नहीं है. जैसे इसमें थी ना on the left side, left हमारे पास left sagittal fissure था जिसने इसको दो में डिवाइड कर दिया. But on the right side it is not the case on the right side. ठीक है, in the right side we have got again a right portal fissure. ठीक है, और ये कैसे मार्क करते हैं जी? It is basically marked by the presence of the right hepatic vein. ठीक है, तो ये राइट हेपेटिक वेन आ रही है ना यहाँ पे, इट इज गोइंग टू डिवाइड द लिवर, राइट लोब ऑफ द लिवर टू द राइट मीडियल और राइट लेटरल. इज इट क्लियर जी? पहले लिवर को राइट और लेफ्ट में डिवाइड किया और फिर दोनों लोब्स को अगेन लेफ्ट लेटरल, लेफ्ट मीडियल और राइट मीडियल और राइट लेटरल में डिवाइड कर दिया. इज इट क्लियर जी? देयर आर थ्री पोर्टल्स, राइट. द वन इज द मेन पोर्टल फिशर जिसने राइट और लेफ्ट लोब को डिवाइड किया. देन दी वी हैव गॉट दी राइट पोर्टल फिशर जिसने राइट लोब को राइट एंटीरियर और मीडियल और द राइट लेटरल और द राइट पोस्टीरियर में डिवाइड कर दिया. Similarly, the left lobe is going to be divided into the right medial, left medial and the left lateral by the presence of the umbilical or the left sagittal fissure. Is it clear बच्चे? कोई प्रॉब्लम तो नहीं है यहाँ तक? हेलो?
No, sir.
Okay, so अब आप ये देख सकते हैं कि we have got how many segments? We have got the हमारे पास 4 components हो गए जी. ठीक है? Okay, I have got the lesson 1 minute. I'm going to invite you again for this one.